Hi, my name is Bill Narita. For the BioExpo, me and my group collaborated with Kenyans and located in Buria, Kenya, to tackle the problem of multi-drug resistant tuberculosis.
Hi, my name is Santos Saeed, and we're from Juanita High School located in Kirkland, Washington. And we did our BioExpo not just to research tuberculosis, but also to work together with people from another continent, another country, another region, from another social standards, like the Buria, Kenya.
Hi, I'm Matthew Stone, and I attend Juanita High School. For our BioExpo project, we investigated multi-drug resistant tuberculosis in Kenya, and we worked collaboratively with a team from Kenya to both identify the issue as well as come up with possible courses of action to combat it.
Tuberculosis is a major problem that affects the impoverished regions in the world. The top 22 countries in terms of TB burden comprise 80% of all TB cases in the world, which highlights the vast divide between countries that lack the ability to carry out TB treatment and the countries that can. It was first discovered nearly 130 years ago and has been considered a very treatable disease. However, it remains the second most common cause of death.
TB is caused by the bacterium called Mycobacterium tuberculosis that predominantly attacks the lungs. In some cases, the bacteria can affect parts of the body such as the kidney, spine, and brain. If left untreated, TB can be fatal.
It is highly contagious, as if a person affected by the TB disease sneezes, coughs, speaks, sings, the breath and the bacteria can be expelled into the air. However, the disease cannot be spread through simple methods, such as shaking someone's hand, sharing food, sharing water bottles, touching toilet seats, or even kissing. While a person may be affected with TB, not everyone actually becomes sick. As a result, two TB-related conditions exist. The first is TB disease, and the other is latent TB infection.
Latent TB infection is when the TB bacteria lives in the body but does not make the host sick, as the body fights the bacteria to prevent growth. Those people cannot spread the TB bacteria to others. However, if the TB bacterium becomes active in the body, the person can become sick. On the other hand, those that have the TB disease do not have the immune system to stop the bacteria from growing. Because of this, people whose immune system are comprised by disease such as HIV and are at high risk of developing active TB disease. The risk of being infected by TB is increased not only to HIV infection, but also by incorrect treatment for TB infection.
The symptom that is most associated with the TB disease is the coughing up of blood or sputum, and this is usually accompanied with a pain in the chest. Other signs may include fever, sweating at night, chills, fatigue, but these can be associated with other diseases. Testing is usually done through two different types of methods. The first is the TB skin test, which is performed through injecting a purified protein derivative of tuberculin into the surface of the forearm. The reaction of the swelling will then be measured 2 or 3 days later. The other method is the TB blood test that measures the immune system's reaction to the bacteria. If the gamma release assay shows a positive result, then the person has been infected with the TB bacteria.
Treatment for TB is done by medication. Latent TB infected and TB disease patients should both be treated. While latent TB infected patients may not be sick because of the inactive bacteria, they are treated as a precaution due to the bacteria's possibility of becoming active. Due to the fewer bacteria in the body for latent TB infected patients, treatment is much easier.
Isoniazid, rifampin, and rifapentine are all options for medication. In the case of those with the active TB disease, several drugs can be taken for 6 to 9 months. These include the 3 drugs mentioned before, as well as pyrazimide. The first 2 months are called the intensive phase, which is then followed by a continuation phase of 4 to 7 months. It is crucial for patients to follow these regimens, not only to cure their TB, but also to reduce the emergence of drug-resistant tuberculosis. If a patient decides to cease their medicine or takes the drug in a manner that is not described or prescribed by the doctor, then they become sick again, leaving behind TB bacteria that is actually resistant to the drugs that were taken before. This is how MDR TB is formed.
Multi-drug resistant TB is a big problem today due to its ability to fight the most potent TB drugs. It is classified as a disease caused by an organism that is resistant to at least isoniazid and rifampicin. MDR arises due to mutations in the bacteria that have been able to survive due to inadequate taking of medication, whether that is the doctor's or patient's fault. Due to the bacteria's resistance, TB is harder to treat as a result. The cure rate decreases from over 90% for the traditional TB to 50% or less for the multi-drug resistant strain.
We have come up with a number of possible solutions in order to address the problem that is MDR-TB. One problematic aspect of MDR-TB in certain countries is the lack of diagnostic abilities. By purchasing gene expert devices or devices that act and operate in a similar manner, we believe that we can increase the diagnostic capabilities of countries. This in turn will allow people to be diagnosed early on and also be able to receive the medications faster. This in turn increasing the number of people who survive. Another issue that has to be addressed with tuberculosis is the stigma which invariably comes along with it. So even if Kenya had if its diagnostic capabilities were up to par with other more industrialized countries, many people would still not seek the treatment despite being diagnosed. So in order to address this, we believe that a comprehensive education program must be instituted so that people won't be fearful of being ostracized and not seek the medical treatment which is necessary. By dispelling the inaccuracies about TB, we can increase the number of people receiving treatment, and this will in turn save lives.
Hi, I'm Steve Schwartz. I'm a professor of epidemiology at the University of Washington in the School of Public Health.
What are your thoughts on the possibility of introducing mobile health programs and helping delete the patient default with regard to their treatment?
Well, one of the great advantages that communication-wise is present in much of the developing world, including sub-Saharan Africa, is that there's a huge reliance on availability of cell phones, and in many disease situations we have found that patient care can be improved through a variety of mobile methods. The simplest one is sending text messages to patients to remind them to take their pills, for example. This could probably be introduced in some way to help avoid MDR-TB so that people fulfill their full course of treatment when they are prescribed drugs for that.
Okay, so what are your thoughts on possible solutions on MDR-TB?
There are a variety of strategies that have been well developed and well validated for use to combat MDR-TB, both technological and at the community level. Many of these things, though, require extensive resources, both in terms of infrastructure and economic resources. So we have some really good tools and opportunities here. What we need is sort of the economic and political will to make these things happen so that MDR-TB can be combated so there will not be this kind of problem that it is today.